Back to class next week, and that means viruses can hop from child to child that much easier with them in close quarters. KENS 5's Jeremy Baker reports one of those illnesses parents and kids need to watch out for is the latest round of COVID.
Right now, we are in the middle of the annual summer surge of COVID. Part of the reason so many were traveling over the summer, and the current variants have found a way around our immune system, which is starting to wane from the most recent round of vaccines.
We're not seeing more severe disease with a huge spike in hospitalizations, but it remains very transmissible, and lots of people can get ill and actually just mildly ill to where they might be out still circulating and transmitting it to others.
The latest weekly number from the Texas Department of State Health Services shows that COVID cases in Texas have gone up by 36%. So what should be done to keep kids as safe as possible in the classroom?
The most important thing is that if somebody is sick, it's best for them to stay home until they're not having a fever and their symptoms have improved, to try and reduce their risk of transmission to others.
The latest COVID variants are nicknamed Nimbus and Stratus, and they are no more deadly than previous variants. However, the CDC is still recommending vaccines for most adults age 18 and up, but it is still extremely important for those 65 and up at a higher risk for severe COVID-19 to get them too. For children, the CDC is recommending shared clinical decision-making where patients and clinicians work together to make healthcare decisions. And if your child gets sick, make sure they aren't getting advice from social media.
It's always good to ask questions. Then the physician can help them with a credible source of information, as opposed to picking up things that you might get through social media, which may or may not be credible sources.
Dr. Bowling also tells us to make sure you continue to practice good hand hygiene, especially when it comes to coughing and sneezing, and make sure your kids do as well. Jeremy Baker, KENS 5.